Health and Human Services Secretary Alex Azar is with us now. Mr. Secretary, thanks for being here. Appreciate it.
Glad to be with you, Shep. Thanks for having me.
You heard Meg's reporting on antibody treatments and how they're not being used. Those can be lifesavers. Why aren't they being used?
Yeah, Shep, her reporting was spot on. We have a surplus of these monoclonal antibodies right now, the Regeneron and Lilly antibodies. And what's happening is people are waiting too long to seek out the treatments until they show up at the hospital. And by then, it may be too late in order to get the benefit of these antibody treatments that beat back the spread of the virus. In addition, our doctors need to prescribe and use these products early in the disease progression. So basically, if you are over 65 or at risk of serious complications or hospitalizations because of comorbidities, what have you, and you test positive, you need to seek out and get the Lilly or the Regeneron monoclonal antibody. It can dramatically reduce the risk for us of hospitalizations at a time when our hospitals are getting very crowded with people with COVID.
Mr. Secretary, this is new to me. I'm 56. I have comorbidities, as so many in our audience likely do. If I test positive when CNBC tests me tomorrow, I should start taking those right away, or at least talk to my doctor about it?
You should absolutely talk to your doctor about it and see if it's right for you. But if you have comorbidities, 56, if you're at risk of getting into the hospital, you ought to get on that product as soon as possible. But here's the challenge. So many of us, if we get it, we start out fairly asymptomatic or light symptoms, and it's an infusion. And so there's a natural resistance of people to an infusion if you're feeling healthy.
Not
yeah,
here.
So,
I test positive tomorrow. That's my first move. Another question, Mr. Secretary. On the vaccine, it's amazing to see them out there. But realistically speaking, when will there be enough supply for the general public? Are we talking about March, April, June, August? Do we know?
So I believe that by the end of February into March, of course, depending on the decisions by our governors, but I believe we'll have enough supply out there to be reaching out into the general public for administration at your CVS's, Walgreens, Kroegers, and near the end of February into March. And if we get J&J and AstraZeneca coming in, their data should be here, we hope, the beginning to middle of January with FDA consideration later in the month, then that would advance that even further with additional supplies from them.
More great news. Yesterday, Mr. Secretary, Pfizer's CEO implied that some of the raw materials used to make their vaccine are in short supply now. Question: why in the world hasn't the United States used the Defense Production Act to make sure we have the raw materials necessary? Why haven't we?
So, Shep, I can assure you that we are working with Pfizer on this precise issue right now. I'm not at liberty
sure, but I wonder
to
why it was that we didn't say, all right, we must do this, Defense Production Act.
Well, we only know, so see, the difference between Pfizer and the 6 other manufacturers of vaccines that Operation Warp Speed works with is, with the other manufacturers, we're actually helping with R&D and manufacturing. Pfizer, while we guaranteed purchase of $2 billion of vaccine, and that is critical for their ability to develop that vaccine and put the capital investment in, they are more secretive with us about their manufacturing capacities, their needs. So we can't know they have a raw material problem until they tell us they have a raw material problem. And at that point, I can assure you, as the president has, we will use every power of the United States government to ensure they have what they need to fulfill the contracts that we need for the United States people.
Got it. We all know they went first in Great Britain. Now they cannot say how many people have gotten the vaccine, which suggests that the government there is struggling to keep track of every person along this supply chain. Can you tell us now how many Americans have received the vaccine at this point and how we'll get that information over time?
Yeah, so it's a good question. I can't tell you at this precise moment how many have gotten it. We're just, of course, 2 days into the vaccination program, but we do have the IT systems to generate that data and get that reporting. And as we go several days or maybe a week into this, we'll start providing a dashboard with that type of information so we know exactly how we're doing on getting shots in arms. It's important information. We have it. We literally track each box, GPS, temperature control, every truck. We've got a command center here with it. So we'll be able to start doing that type of reporting, Shep.
Secretary Azar, before we go, while we wait for vaccines, more Americans are sick, hospitalized, and dying than ever before. We are among the worst in all the world statistically, the United States. What, Mr. Secretary, can the federal government do now to slow this spread so we make it to this vaccine?
So what the first thing that we need to do is what we talked about at the opening of this segment, which is get those monoclonal antibodies into people who are at high risk to keep them out of the hospital in the first place. But we need to do what Europe has to do also, because they're facing the exact same explosion of cases. We all as individuals have to act responsibly, wash our hands, watch our distance, wear our face coverings when we can't watch our distance, stay out of crowded indoor settings like overcrowded bars, overcrowded restaurants.
I don't want to belabor a political point, but I mean, they're not even doing any of this at the White House. You know, it's not that we're hearing words, but the actions speak volumes for those who follow people in power. Can you apply any pressure to the White House and to other leaders in Washington to please set a good example, wear your masks?
So, Shep, I've actually been to some of the White House Christmas parties, and in fact, I just was at one last night. And there, if individuals took their masks off when they were not actively eating or drinking, there were actually military aides and ushers who were telling people to put their masks back on. I had my mask on at all times, and if people approached me without a mask, I would push back on them, saying, keep your distance, please. If you don't have your mask on, I don't want you near me. So we do try to set that example. People were instructed they need to wear masks at those events. Right. Our advice is the same in any setting. Wear your mask if you can't keep your distance.
HHS Secretary Alex Azar, all the best to you, and thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.